Hello, my name is Sonia Rehal, and I live with lipodystrophy, specifically familial partial lipodystrophy, Dunning and variety. I am also a basic scientist, having earned my PhD in physiology with a specialization in pharmacology and therapeutics. And so today I would like to take the opportunity to discuss why our fat loss in this disease makes us sick. And so, just a brief overview of partial lipodystrophy. It is, as described in the name, a partial fat loss syndrome. And so, fat loss often in this disease is confined to our lower extremities, our arms, our legs, our buttocks, and other patients can have different areas with fat loss as well. Just to note, there are areas with fat excess that are characterized in this disease as well. So what this means to us is because of this fat loss, we have an accumulation of fat that would normally be stored in fat cells, but now we don't have as many fat cells. And so our fat that is digested through our body has nowhere to go, and it accumulates outside of fat cells. And specifically, what's happening in our disease is the fat cells are dying. And so, really, our fat storage containers are not there. And what does that mean to us? Well, fat cells are a very important source of hormones. And one of the more important hormones for us in terms of relevance to our disease is leptin. And so we do not create enough leptin because we do not have the right amount of fat cells in our body. Also, this excess lipid droplets in our system that don't go into fat cells causes inflammation, and it also causes dysfunction to our endothelial cells, which are lining all of our blood vessels in our body. We also start getting what you call ectopic lipid accumulation. So basically what happens is the fat has nowhere to go, it stays in our blood, and it starts kind of sticking onto our visceral organs, such as the liver, the kidneys, the heart. The list can go on, but mainly it's the liver. And so what does this mean for us? Why do we feel so sick because of these things? Well, for one thing, because of the low leptin, we're constantly hungry. So the thought of food is constantly on our mind. And really, this makes it very difficult for us to function properly when we're constantly thinking about eating. We then, because of the inflammation and endothelial dysfunction, have increased risk of insulin resistance, diabetes, and the associated polycystic ovarian syndrome in females with this disease. And so what we end up having is insulin resistance, and if we have high blood sugars in our body for a long enough period of time, this will develop into full-blown diabetes. And the insulin resistance can also cause hormonal issues with us, leading to PCOS. And that can also affect us in many ways, leading to abnormal menstrual periods, facial hair, darkening of our skin, called acanthosis nigricans, and the list goes on. We also develop hypertension because our vessels are not functioning properly, because there's this endothelial dysfunction. We have a likelihood of developing high blood pressure. And again, as I described before, our liver is one of the popular areas where the excess fat lipids like to stick to. And we end up getting fatty liver, which can make a risk for fatty liver disease and cirrhosis if it progresses. We also have those excess fat droplets running around in our blood, and that causes hypertriglyceridemia. And in a lot of patients, what ends up happening is the inflammation of the pancreas, which is an extremely painful disease called pancreatitis. And it's not fun to have, and it can lead to serious complications. And finally, a lot of us experience muscle pain, and this can be in a variety of places. And it's often termed as myalgia. And basically, myalgia means inflammation of the muscle cells. And this is most likely due to the inflammation going on because of those excess lipid droplets. I also wanted to mention the heart in lipodystrophy. The more and more we find out about this disease, the more we realize that the heart is significantly or can be significantly affected by our mutation causing our lipodystrophy. Specifically, our lipodystrophies can make us susceptible to developing abnormal heart rhythms, also known as arrhythmias. And these arrhythmias can be from a common heart murmur to dangerous heart rhythms such as ventricular tachycardia. Some people need pacemakers and defibrillators to deal with this, to be implanted in them to help prevent sudden death from these rhythm disorders. And these are thought to be brought by cytoskeletal and nuclear mechanics that are changing because of our lipodystrophy. Furthermore, we can also deal with cardiomyopathy. Cardiomyopathy means the disease of the heart cell. And there's postulated mechanisms by which this can occur. What it means to us is that the heart as a pump may not function as normally as it would for a healthy patient. And so we need to keep an eye on our heart health and make sure our system is getting enough oxygen and that the heart is pumping effectively enough. And again, there's vascular dysfunction that is related to the heart, and that's also due to mechanical stress, as I mentioned before, and that can also lead to blood vessel disease, increased blood vessel disease in us. And finally, I would just like to touch on kidneys. So because this syndrome is associated with developing diabetes, which is uncontrolled, can lead to diabetic complications such as nephropathy, which is basically kidney disease. And what we're also finding out through recent studies in science is that there's actually a predisposition for lipodystrophy patients to actually develop protein, high levels of protein in their urine. And so our kidneys are innately leakier than a normal, healthy person. And the new studies are suggesting that's actually due to the lipodystrophy changing our kidneys at the level of their basement membrane, which starts getting thicker than healthy kidneys. There's also extracellular matrix abnormalities in the kidney, injury, and lipid accumulation, which are all thought to contribute to leaking kidneys. And so this is just a brief overview of some of the metabolic problems that we deal with living with lipodystrophy. This is not an exhaustive list. Many more problems are experienced by lipodystrophy patients, but really these are the hallmark signs of how our fat loss is making us sick. Thank you very much for your attention, and I hope this was helpful.